Welcome everybody to this C&D TUC Fringe meeting. Obviously just letting participants into the meeting, so just give that a couple of minutes and then we'll get started. So nice to see you all here. I know there's lots of competing fringe meetings on at the moment. It can be a hard choice sometimes between the different ones, so it's great to see you come along to this important discussion. And we are being live streamed at the moment as well. So just in case anybody doesn't want to be on camera, then obviously you can turn your camera off if you don't want to be seen. But it is very nice to see all your faces and to be talking to people directly. It does help a little bit. Okay, we've just hit 12:30, so we've only got an hour. So I think we probably should get started, and hopefully any latecomers can catch up. So as I said, welcome to this C&D Fringe meeting as part of TUC Congress 2021. For those of you who don't know me, my name is Sam Mason. I'm a policy officer at PCS Trade Union, and I cover sustainability and climate change at PCS. I'd just like to say first, I mean, it is a real genuine honour to be chairing this meeting, one personally as a C&D member, but also from a trade union that very proudly opposes nuclear weapons and nuclear energy. And just on that, it was very good to see us participate in the opposition yesterday to the climate change motion, composite motion number 2 that got carried, led by the GMB amongst some other unions, but now sets a position to support nuclear power as TUC policy, although there were a number of unions opposing that as well. Also in that was about small nuclear reactors too, and obviously, you know, some of you will be aware there are close links, which many of us believe, between the nuclear power agenda to the civilian agenda to the defence agenda as well. Obviously today we're talking about nuclear weapons, and in contrast it was welcome to see at the SNP conference yesterday their vote to remove Trident within 3 years of independence. Now obviously not get into a debate about independence in Scotland, but it's still heartening to see in Scotland, where the whole idea of supporting the nuclear deterrent nuclear weapons isn't argued for in the basis of jobs or for the local Scottish economy as well. And again, our discussion today, of course, is more than Trident, and it is, you know, in part a response to the UK government announcement last year that it will increase the number of warheads by 40%, and also the biggest defence spending increase for 70 years. And it does beg the question, has been put, obviously as part of discussion for this meeting, where our priority should lie in the face of an ongoing public health crisis, a climate crisis, and of course a workers' pay crisis as well. Now, coupled with this, obviously there's been a really fantastic campaign by C&D around nurses, not nukes, on the back of the paltry pay increase declared last year. But of course, last week we've just seen as well the 1.25% increase on national insurance and what will become a social care levy by the government, which will impact lots and lots of low-paid workers. So it seems another case of, you know, robbing the pay packets of working class people to cover the shortfall in costs, which won't actually go into social care, which will go into propping up some of the NHS spending, but robbing Peter to pay Paul at the further expense of workers, and won't tackle the very severe holes that we've got in our public services, and particularly in our health and social care sectors, and which was so graphically exposed by the COVID crisis, which is still an ongoing crisis as well. So of course, these are all really important discussions, and particularly in this year of the climate change talks in Glasgow, COP26, which will happen from the 31st of October to the 12th of November. And so there's no more urgent time really than to say no to nuclear and to put pressure on our government to reframe what is real human and what real human ecological security means and where those priorities should be. Unfortunately, I'm going to have to apologise that a couple of our speakers have been unable to make it today. So firstly, just to mention Mark Curtis, who unfortunately isn't very well at the moment, and we obviously wish him well and send him our greetings. So he won't be able to join us. Of course, Mark was the editor, or it still is, sorry, the editor of Declassified UK, which is a media organisation investigating the UK's role in the world, especially military and intelligence policy, and author several fantastic books as well, which I really recommend. And he's written as well about the extravagant expenditure that the UK government has committed to military projects while failing to ensure national health security. And I've got a link to an article if you've not seen it, which I'll put in the chat in a little bit. Rachel Ambrose as well, a mental health nurse from Nurses United and Nurses of Colour Network, of course, being a frontline nurse working in child and adolescents mental health services, unfortunately also is unable to join us due to having to, she's currently on a shift and she's had to cover somebody else. We was hoping to be able to show a little video, which for technical reasons we're not able to at the moment. If we're able to resolve that by the end of the meeting, of course, we can run that. So apologies for that, but I'm hoping we're going to have some good discussions, and obviously encourage you all to think about questions and contributions to make as well once we've heard from our two speakers, which I am pleased to say are here. And without further ado, I'll move to our first speaker, Dr. John Puntis, who is co-chair of Keep Our NHS Public, a retired consultant paediatrician, and as I said, co-chair Keep Our NHS Public, campaigning for a publicly funded, provided and accountable NHS. So over to you, John. Thanks.
Thanks very much, Sam, and many thanks to CND for the invitation to COMP, who I'm representing. So I'm going to talk about the current settlement for health and social care, and then the impending legislation that's going through Parliament at the moment, the Health and Care Bill. And just want to begin by looking at the most pressing problems for the NHS, mainly because these aren't actually being addressed either adequately by the funding settlement or through the new legislation, which is very much a major top-down re-disorganisation, once again, of NHS services. So even before the pandemic, there were over 100,000 staff vacancies estimated. That's probably an underestimate, and that included 40,000 nurses. And not surprisingly, things are now worse in the sense that the huge pressure on staff is leading to difficulties with recruitment and retention. And obviously this has not been helped by the very low pay award. Waiting lists, everyone knows, have gone up very strikingly, now stand at over 5 million. But there's also, as Sam mentioned, you know, the pandemic is not over, and there's a need to manage the ongoing pandemic, which is very consuming of both time and money for the NHS, at the same time as having to try and catch up with the backlog of work. There's also a crisis in general practice, with GPs being absolutely overwhelmed. And that government promise a few years ago to increase GP numbers by 5,000 has translated into an overall 4.5% reduction in GP numbers. Many are retiring early due to burnout and pressure. But the biggest issue, I think, is chronic underfunding. And this includes a huge maintenance backlog where there's no money to pay for that. A serious lack of up-to-date equipment, including such things as diagnostic scanners. So what kind of solutions are government offering, if any? Well, the recent funding settlement is welcome. I mean, one would never say no to more money, but 36 billion over 3 years is simply nowhere near enough. And this is for health and social care. And as you've heard, it's actually being raised by taxing the lowest paid workers through national insurance, which is just about the worst possible way of raising that money. Leaders of the NHS Confederation and NHS providers have called for an extra £10 billion now and estimate just the ongoing costs of managing COVID are about 4.6 billion each year. But the government is coming up with just 15 billion over 3 years. Traditionally, we have to remember, for years and years and years, the NHS always had a 4% annual uplift, more or less, which just about allowed it to keep pace with increasing demand. And then from 2010 onwards, the uplift was reduced to around 1%, with slightly more in the last few years. But that means that the NHS was really struggling with what was an accumulating deficit of around 3 billion or so every year that's never been made up. So real terms funding for the NHS has fallen year on year behind what's actually needed to meet increased demand and inflationary pressures. And this has led to a massive accumulated deficit, which is simply not mentioned by a lot of those in government and in positions of influence within the NHS. Governments have been, if you like, digging a deepening black hole for the NHS and social care. And now the NHS is in a position where it's being asked to make really impossible decisions about which patients and services should get priority. Just at the moment, 7,000 beds are actually taken up with COVID patients, and a further 14,000 are closed because of the problems imposed on the service by COVID in terms of social distancing and trying to reduce cross-infection in hospital. And this shows how difficult it's going to be to catch up with the backlog without massive investment. And yet one of the government responses has been to give a 4-year, £10 billion contract to the private sector for catch-up work. Now, bear in mind that these are generally small hospitals, don't have a very good safety record, don't have intensive care facilities. And most of the staff actually are working in the NHS and then go and spend some of their time in the private sector. This is the biggest private contract for clinical services that we've had. And I think it shows where government priorities actually lie. So there's this huge deficit in maintenance work representing about £9 billion in costs. And some hospitals like Queen Elizabeth in King's Lynn, James Paget Hospital in Great Yarmouth are literally falling down. Meanwhile, the 48 hospitals which were promised by Johnson in the last election, actually only 8 of them were funded projects, and they weren't all new hospitals. And they're now actually being asked to revise plans in the face of pushback by the Treasury and come up with something of lower cost, or to phase the building, which is a nightmare. So, for example, in Leeds, there were 2 new wings being built. They haven't started. They were costed at 600 million. Now they've been asked to resubmit plans for 400 million. That's a huge change. So no new hospitals have been built. And I think there's a question mark about any of them being built. But the Department of Health's response to that has not been to find more money. It's for the communications team to tell everyone that any refurbishment or rebuilding work should be referred to as a new hospital, so the public have the wool drawn over their eyes. Unfortunately, one of the effects of the pandemic is through these soaring waiting lists to drive people to the private sector for reasons which are understandable if you have the money and you're desperate. But it's also undermining the NHS model of care in many people's eyes who are seeing it as not fit for purpose. And fantasizing about saving loads of money by moving care into the community without investment in the community, use of data and digital health, efficiency savings, integration of services and all the rest, to fantasize about this compensating for the massive underfunding is just that. It is just a fantasy. Social care is now supposed to be getting 1.8 billion each year for 3 years, but it goes to the NHS initially. And this is a drop in the ocean. This is not the solution that was promised to the problems of social care. 95% of care providers are currently saying they can't take on new clients, while others are not able to fulfill their current contracts with the amount of money coming in. And the GMB union has estimated staff shortages in social care may go up to 170,000. And this is now being worsened both through immigration and mandatory vaccination policies. Just a few pointers as to why what we've heard last week is not the solution to the problems of social care. There's been no consultation about what social care should be, about co-production with users and involvement of staff. The focus is very much on wealthier pensioners, whereas half social care costs actually go on working age disabled adults. The proposals do nothing for the 5.5 million informal carers who are providing what's estimated to be £100 billion worth each year of unpaid social care. There's around 1.5 million care workers, many of whom are paid the miserable amount of £8.50 an hour. And although 500 million has been made available for their professional support and development, that's only £2 a week for each of them. It's nothing. In terms of protecting people's assets and projecting this around, no one will have to sell their house to fund social care. 1 in 5 older people and 3 in 5 disabled people don't actually own a home. And interestingly, and rather horrendously, half of people at retirement have less than 20,000 in the bank. Over the next 3 years, the most that will go to social care is 5.4 billion, and there's question marks about whether how much of that will get there. It's funded, as I said, by taxation of the poor, and half the money isn't new because it's actually going to replace money that people currently with assets will then stop paying in. Other problems are that councils are very strapped for cash, having had their budgets cut. They can still deny care if they assess your needs as too low. That's been a very common phenomenon. And the fact that the whole model of private companies running care homes and avoiding tax is not dealt with, and yet about 1.5 billion are leaking out of the system through the financial arrangements that pertain in the privatised care system. The £86,000 cap actually only relates to personal care costs and not to the cost of accommodation. That's something which hasn't been made very clear. And fundamental problems of access and quality of care will remain. Now, just moving on to the Health and Care Bill quickly, this is going through Parliament at the moment. One really has to question why what is another major reorganisation or redisorganisation is a better term, is happening at this time when there are so many other pressing problems. It does not end or reverse privatisation, despite the fact that it was being sold in those terms, and it could actually increase the role of private companies and their influence. The Secretary of State is going to get sweeping new powers, but doesn't take back responsibility of providing a comprehensive service. The integrated care systems, 42 geographical structures within England, covering 3 to 4 million people. That's a reduction in the current architecture of the NHS, which will reduce local accountability over cuts and closures taking place. The chairs of the integrated care boards, who for interest are being appointed on a salary of £250,000 each a year, are appointed by the Secretary of State, have no local accountability and will be very difficult to remove. Foundation trusts are left free to ignore local plans and left free to maximize private patient income. Some of them are doing that already. Boards, as they're constituted, don't attempt to give a voice to patients, to mental health, public health or other staff, or to trade union representatives. And the new payment scheme that's being advocated could lead to a postcode lottery on the level of funding for specific services, and there may be new powers to deregulate professions, which could undermine quality and safety of care. There's also a potential threat to national pay and conditions. So this is the wrong bill at the wrong time that doesn't actually address seriously any of the major significant problems in the NHS. Although it's being promoted as implementing important lessons learned during the pandemic, we in Keep Our NHS Public think, unfortunately, that they've learned the wrong lessons, and the right lessons to be learned from the pandemic include that now is the time to rebuild public services and to think in terms of defending the population, not as putting huge amounts of money into weapons systems, but investing in good public services and a public health system that helps us all live happier and more productive lives and fosters international cooperation through, for example, promotion of vaccine equity and future pandemic preparedness, which relies so much on nations working together. And there has to be a change in the narrative. Such services shouldn't be as a drain on the economy, but as an essential part of adding value to our lives and as eminently affordable. We're already spending 4.5 billion a year on nuclear weapons program. We don't need to spend any more. A 40% increase in our stockpile is just unbelievable and unjustified. The pandemic has shown that government can find money if it wants to. For example, the 37 billion that's gone on the test and trace system, incidentally, which the Commons Accounts Committee said they could not find any evidence that it actually reduced the spread of infection. Also, the massive contracts for such things as personal protective equipment handed out to cronies without scrutiny. And we're worried that the government have learned those kinds of lessons, that it can hand out money to supporters and cronies, and that's really where their focus is. Around 12 billion would give all staff a 15% pay rise, and that money actually would flow back into the economy. So this whole meeting really and topic is about resetting priorities. It is time to reset priorities, and just paying staff a decent wage would be a really good start. Thank you very much.
Thank you, John. That was a really excellent overview and really setting the framing for that. So I'll hand over to Kate now. Sorry, just before I do, I did notice a comment in the chat about this being England centric. I think point taken. I mean, obviously that is the focus of those particular bills going through Parliament, but I mean, of course, in contributions or questions, it'd be good to hear from sort of alternatives that are happening elsewhere. So I'll hand over to Kate now, who I don't think really needs an introduction as General Secretary of C&D. Thank you, Kate.
Thanks very much, Sam. And well, just to really follow on from where John left off, this question of what are government priorities, because it's quite clear that money is there. You know, we've seen this with military spending over decades. You know, no matter how much the government says, sorry, we haven't got enough money for this, we haven't got enough money for that at home to meet people's daily needs and health and so on, housing. But then when it comes to wars and nuclear weapons, there seems to be a bottomless pit. And I think that over the last year, having seen not only a kind of continuation of military spending at the same level as before, which is high enough, you know, or even an increase in line with inflation, just the kind of scale of the massive expansion of military spending and military projects that we've seen over the last year. I mean, it really is beyond belief that the government could do that during a pandemic, and you just do wonder what is in their heads. And I think, of course, John has really outlined a lot of that in what he's been talking about. But you did say one thing, John, which was that, you know, this isn't new, this question of priorities and so on, and that's absolutely the case. And in the last just over a decade since the financial crisis of 2008, it's really been much sharper than it has been before. And with the coalition government, which came in 2010, you know, it was all about austerity. There is no alternative. We're so-called all in it together, which of course was just nonsense, you know. But that's when we really took up the slogan NHS not Trident, because at that point it really became starkly clear that there were choices to be made about money, and money was there, and it was a question of what would you spend it on. I mean, it came down to an ideological perspective that the government had, particularly in terms of how the government defines what security actually is. And of course, I'm sure that all or most of us on this Zoom would talk about health security, for example, climate security, job security, all the basics, you know, the kind of peace and all those kinds of things which are really make our lives secure. So from that time on, we really have campaigned very strongly around NHS not Trident. And of course, over the last decade, it became particularly sharp because of the decision by the government to replace Trident, not only to continue with the existing level of spending, which John was talking about, you know, around about 4 billion a year on the existing nuclear weapons system, to build a whole new nuclear weapons system, the cost of in excess of 205 billion pounds, you know, the kind of just piling on more and more big ticket expenditure, not least at a time when people, scientists and engineers and so on, have raised very serious concerns about whether the system is actually a fit for purpose system. And I'm just going to digress, sorry for digressing from a very serious subject, but I don't know if anyone's been watching the Sunday night BBC series Vigil, you know, about this kind of crisis going on under the sea, you know, on the Vigil, which is like one of the Trident submarines and so on. But, you know, actually a lot of what's shown in there is based on true things that have happened, you know, around security problems and infiltration. And, you know, there've been a lot of whistleblowers around what happens on nuclear weapons submarines, you know, so those are all real concerns as well, you know, that putting our security at risk. But obviously with the pandemic, all these issues about what is security, what do we want to spend money on, what are the priorities in the pandemic, they've become even more sharp. And I think it's worth noting that successive governments have actually identified pandemics as a major security threat. I mean, for well over a decade, I think going back to the kind of the Blair period in the previous decade, you know, that pandemics are recognized, have been recognized as a major security threat. But the government just hasn't, successive governments haven't really put in the necessary investment for the NHS to be able to deal with a public health emergency on that scale. I mean, it's just gross negligence, really, apart from anything else. But if you look at those national security strategies going back over a decade, they all identify real things, you know, like climate change, you know, problems of flooding, population movements, things like organized crime, cybersecurity. They recognize all those things, but they still put money into massive military projects, you know. So it's even though things like pandemics were at the top of the government risk assessment. So it's just a kind of a real problem with government. Now, one of the things that we saw during the first wave of the pandemic was actually a very, very positive response to these kinds of priority questions. And I'm talking about the way in which government production or government manufacturing for government purposes and so on was very quickly repurposed to deal with the real security problems that we were facing. So I'm talking about things like the lack of ventilators, for example, which was a real massive problem in that first wave. Okay, so you may remember they asked Dyson vacuum cleaner company to make ventilators. You know, what a crazy thing. And of course, obviously, they weren't able to do that. And what happened very quickly was that top level engineering industry got together in the UK Ventilator Consortium and produced pretty damn quick the necessary equipment, and other manufacturing production was repurposed for the production of PPE and other medical equipment and so on, you know. And this was defense diversification in action, because many of the companies not only were arms producers, but were actually nuclear weapons producers, you know. So all for decades, oh yeah, C&D, the utopian fantasies, you can't do that. Well, actually, when you need to do it, you can do it, and that happened. And I think what's regrettable is the way that that experience now seems to be being brushed under the carpet, you know. And I don't know, maybe Sam could say something in the discussion after about whether unions are pushing on that. But I know the TUC voted a couple of years ago to support a defence diversification agency, and a shadow one to be set up by the Labour Party. And there doesn't seem to have been movement on that. And it seems to me that the pandemic really underscores more than anything else the need for that to take place. So I hope that that's going to be a live agenda item for the trade union movement. And then just to say very quickly, Sam, just one or two other things about what John's already mentioned, you know, about this massive new wave of spending and military and nuclear expansion. So last autumn, the government announced a huge increase in military spending. That's around 20 billion on top of the existing spending. That increase included things like a space agency, you know, cyber this and that, sending a big aircraft flotilla to the Far East to provoke things, you know, displaying global Britain, you know, in a military framework, obviously. So, and then in spring of this year, then actually they published this thing called the Integrated Review, which complete bolt out of the blue announced that there was going to be a massive increase in the nuclear arsenal, in excess of 40% increase in the nuclear arsenal. And as John pointed out, this was the time going through the depths. I think it was the third wave by then, the third wave of the pandemic. Nurses were being told 1%, but at the same time, over 40% increase in the nuclear arsenal. I won't even touch on the fact that it's illegal under international law. It's kind of breaking the trend ever since the end of the Cold War, which is to kind of reduce the arsenal. You know, I'm sure you know all about that. But it just really serves to underline a whole lot of really, really bad things. And as this week is the week of the DESI Arms Fair at the Excel Centre in London, we're in the middle of big protests there, you know, just point out it's not just a question of government spending, you know, it's also a question of people choosing to make profits from death, you know, selling arms, and we all know what happens as a result of that, and our government's complicity in selling arms to oppressive regimes. And yesterday we were on a demonstration which was highlighting selling arms to Israel. And of course, Israel is a nuclear weapons state, you know, and Britain helped it get nuclear weapons illegally. You know, there are all these kinds of issues all tied in to this question about our government's military spending. So our vision, of course, is one of a world where security means the right to health and housing, sustainable employment, clean air, and so on. Sam's talked about COP26, you know, absolutely fundamentally important to us, and the right, of course, to peace based on justice and respect in international relations with other countries. You know, we've seen the disaster of the war in Afghanistan, you know, that must show, hopefully people will learn the lesson that sending troops to places, bombarding them, is not the way to get a kind of democratic and equitable settlement and peace in that region. So we will continue to fight for that vision of peace, justice, and of course social justice. And paying decent wages to our nurses is a central part of that vision. Thank you, Sam.
Thank you, Kate. That was, again, another really excellent overview and bringing together all those issues. You did just mention defence diversification, so I'll take liberty of the chair just to say something on that. And I noticed in the chat earlier someone mentioned about the vote yesterday, the GMB climate change one. Now I've seen the numbers because of course different unions have different weighting in terms of the vote, so it's being called around about 2 to 1 in favour, but I think for me what was quite significant is Unison actually voted against that motion, and that's quite a good shift in terms of which is now the biggest TUC affiliate union coming out against nuclear and some of the other things that were in that motion, which it wasn't all bad in the motion. Unfortunately, there were some good things in there we would like to get behind as well. But I think at the moment, in terms of the defence diversification discussions, unfortunately, there's nothing happening on it. We had that very successful TUC Congress motion, I think it was in 2017, which was brought forward by the trades councils, really coming out of that sort of celebration of what the Lucas aerospace workers achieved in the 1970s, and a anniversary event that we had for that in 2016, not just to be nostalgic about it, but obviously to look at how they organised and the ideas and how we could bring that into today's discussions. So we're really kind of, and obviously with changes in the Labour Party, we're a little bit back to square one on some of this. And I know we're sort of having to reconfigure a bit some of our approach and discussions around it, unfortunately. I mean, I think the only thing is perhaps where it's shifted a bit is we do need to see this as part of a wider industrial strategy about how we deal with all these issues, obviously including the failings around the health and social care services, around public services more broadly, and about the transitions that we need to make. And it's very rarely as well, because we tend to get stuck in these kind of hard hat discussions, if you like, around the decarbonisation transitions, rather than looking at the wider things that we need and jobs in society. And I was just having a quick look, because last year, obviously with the collapse of the aviation industry, so it's a different sector and subject, but we did do a report, PCS, along with Green New Deal UK and a greenhouse think tank, on actually looking at what would be a Green New Deal for the Gatwick area when so many jobs were dependent on aviation. And, you know, it was quite interesting to look at how the gaps there, as John so clearly highlighted, around social, you know, care jobs, social care jobs and health sector jobs. And clearly, you know, we're very careful not to advocate, if you worked in cabin crew, you might want to go into social care, which there was quite a lot of that being said at the time, because I, you know, can understand that if you wanted to be part of cabin crew, although you've got transferable skills, you've probably got some slightly different motivations. But you know, we need to talk as well about those gaps that are there already in filling out our public services and rebuilding our public services. But I would like to open it to the floor from any contributions, questions. So if you could put your hands up in the chat, would be the easiest way to see you, or you can perhaps try and...
Well, I think we need to get...
Is that someone want to come in? Is that John Barster? Okay, yep, I'll call you in, John. I think you're the first hand I can see.
Yeah.
Go ahead.
No, thank you very much. Yeah, thank you very much. I think that it shouldn't be either or. You know, we need adequately funding the health services and better pay for health staff. And there's also a case for a higher defence budget. I think the way forward with the Trident nuclear deterrent is for the whole thing to be funded from central treasury sources, so the normal defence budget doesn't get eaten into and goes further. And things like, you know, military ties with Europe is, you know, an essential part of, you know, UK strategy, and, you know, will be, you know, vital sources of leverage going forward. And we've got to take into account so many unionised jobs revolve around the military industrial complex. And, you know, you do get sort of, there are medical sides of the services, and very often they go into the mainstream NHS. And let's never forget, you know, Ernie Bevin, he was a great trade union leader after the Second World War. It was his influence that founded NATO, got the Berlin airlift off the ground. And, you know, despite the dire economic conditions, more resources were ploughed into the military services to really show business. And at the same time, you know, the NHS was being founded. So, you know, you can do both at once. You know, both the caring side and defence can be done at once.
Okay, thanks, John. We're obviously give the speakers a chance to come back on some of the points raised. So Tom Cuthbert, have next.
Right. Well, just to respond to John's point, I mean, what you're describing has given us, what, maybe 50, 60 years of Cold War and nuclear proliferation. So I beg to differ with your analysis. What I'd like to bring you back to is in January, the National Audit Office interviewed officials from the Ministry of Defence with a view to talking about Trident's funding. And at that stage, they weren't exactly clear they were going to get money for Trident. Now, what I'd ask, if anybody here knows how many contracts have been signed by the Ministry of Defence in the dreadnought so-called Trident supply chain, because as far as I know, it's a bit of a monopoly. There are about 4 big companies involved, but not all the contracts have yet been signed in the supply chain. And that, I think, makes the MOD and the military industrial complex feel a little bit nervous at the moment. They have got money up until 2026, and there is, of course, the NATO plan up to 2030. But there is uncertainty about this. And I think for those of us who oppose Trident, oppose nuclear weapons, we see this as an opportunity. They could sign contracts, but they don't necessarily have to be for Trident if alternative work was there. So please respond to that question.
Thanks, Tom. Does Kate or John want to come back at all at this point? Kate?
Yeah, I'm happy to come back. Yeah, interesting point, John. In fact, as you may well know, it used to be the case, although there was a bit of a dispute on the floor of the House of Commons a year or two ago, it used to be the case that Trident was paid for out of central funds, some treasury special pot. And then I think it was the coalition government which put it into the MOD budget and said that the MOD budget would have to make which is a limited budget, would have to make the MOD would have to make its own decisions about what it wanted to spend the money on. And that's been a kind of running saw ever since. It's actually quite interesting with about the coalition government that not only did it do that, but it also began to quite substantially reduce our nuclear arsenal, and it's that nuclear arsenal reduction introduced by the coalition government in 2010, which has now not only been stopped by Boris Johnson, but reversed by Boris Johnson. So it's not even as if, Labour was doing one thing and the Tories are doing another. Actually, you've had this big swing within the kind of continuity of Conservative leadership. So that's quite an interesting thing. I think, obviously, I would have a disagreement with you, John, because I think that irrespective of the cost, nuclear weapons are not the way to go in terms of British defence and British national security. Obviously, we have national security requirements, but there are many reasons, which we haven't really got time to go into now, why nuclear weapons of mass destruction, are not the best way of spending the defence budget. We might well differ on that. But I think in terms of the jobs question, which is of fundamental importance, it really comes down for me to what Sam mentioned earlier on, the question of the need for an industrial strategy which factors in defence diversification. So we're not in a situation where we're abandoning fantastic engineering skills. They are engineering skills, top grade skills, which are being redeployed into other areas on a comparable level of expertise. And of course, the need for production for sustainable energy, for example, as well as health spending, that's something which has been raised very, very often. So I think there is a really important discussion around that. And then just touching on what Tom said, just to say, I'm sure, Tom, you'll be aware, very knowledgeable about these things, that there have been frequent leaks from top civil servants saying, government, hold back, you're committing to spending in all these areas, military areas, but the military budget just isn't big enough. It's like kind of quite grandiose schemes for military spending, which just civil servants think is not sustainable. So again, the ongoing debate in Parliament around that and in the committees, which you touched on. Thanks, Sam.
Thanks, Kate. I don't know if John, you want to come back, anything from the health side?
No.
I don't have the figures with me, but I think the concerning thing is that the British military capabilities are being cut back, with particularly reference to the front line of the army. And this is, huge concern to those who do run the defence services.
Yeah, just to follow up on that, I know John Puntis is going to come in on the health side, but just to say, I'm sure you'll have read, John, the integrated review and the kind of accompanying documents which explain what all the money is being spent on. And it's not that they're spending less, obviously we talked about them spending more, but they've made a strategic adjustment away from, as you say, frontline troops and so on, towards much more highly technical kit, and all the cyber stuff, the space stuff, which is in terms of, boots on the ground, it's very, very low intensity. Yeah. But it's very kind of investment heavy and very technologically orientated and heavy. So that's a kind of decision that they've made, away from the boots on the ground to things like unmanned drones and so on. So but I do, if people are interested in this, I do recommend people do look at that integrated review document. It really sets it all out incredibly clearly, not just in terms of the figures, but in terms of the sweep of their global vision for this new global Britain.
Thanks, Kate. Sorry, John Barstow. Can I just bring John Puntis back in, just so
yes,
we don't get into it? Sorry.
Thanks, Sam. Yeah, no, I just, John Barstow made a very important point about the creation of the NHS. So for the people who say, well, we can't really afford a proper health service any longer. You know, you look back at the context of what was going on in a war-ravaged, destroyed economy, and there was this very brave decision made to build an NHS. Most people, you know, are still strong supporters of the NHS, even though there's a lot of people in government trying to undermine it one way or another. But I think that we need to argue in a way that the COVID pandemic is actually this generation's NHS moment, you know, because it's a time when we have to be thinking about what kind of society do we want, and what kind of NHS do we want. And actually, I think the founding principles of the NHS about equity of access and shared risk are still very, very fundamental, and should be enshrined in an NHS which is built for the future and is going to be resilient and is going to be able to rise to challenges such as the next pandemic. So there is a new NHS moment that has been opened up by the pandemic, and that's a narrative that we need to push. Thanks.
Thanks, John. I think that's really important, and you know, and the fact you said the next pandemic, because there will be more pandemics, and we know with the climate and ecological crisis, unfortunately, you know, this is going to be the new normal as well. And I think it just in terms of the health services, which rarely gets talked about, of course, you know, we often see the destruction from climate change, from the severe floods, etc., and wildfires, but you know, stuff like the impacts of heat wave on health and air pollution, all these kind of things which put additional burdens on the health service, is going to increase equally. And that's some of the kind of sort of slow onset silent stuff that we don't, you know, see so starkly on our you know, computer screens or TV screens, wherever it happens to be these days. So again, coming back to these questions of choices about what our priorities should be, our need to respond to the climate crisis is going to be ever greater. I mean, climate change is here, you know, and those investments in nuclear weapons are not going to enable us to deal with both adapting to climate change and the mitigation efforts through the transition to renewable energy, for example, that we need to be doing in less than 10 years now. We are running out of time, you know, and it's always hard to, you don't want to sort of scare people because we all become a bit frozen in the headlights about what to do. But, you know, this really is urgent. And when the UN General Secretary, Antonio Guterres, said it's code red for humanity, you know, I don't think he was just trying to come up with a nice new slogan for everybody. I mean, this is quite serious, which is, you know, why we need to make sure we're putting our investments now in building a peaceful world. And Kate had mentioned about Afghanistan, and I think, you know, obviously the trillions that went into Afghanistan, but again, another area which doesn't get much talked about, obviously the refugees that have been taken out there, and very welcome, but Afghanistan is one of the most climate insecure countries in the world, you know, and has been. It's suffering severe water shortages and all kinds of horrific impacts from climate change now. And you've already got, you know, I think it's something like 370,000 displaced people, both displaced because of the war and climate change impacts, in refugee camps in Afghanistan, you know, which that was from climate events in 2017, I think it was. You know, those people are stuck there. So we desperately need this peace agenda, and to think about it in the whole of sort of global policy. I just want to see if anybody else wanted to come in, make any comments or have any questions particularly. It'd be nice to hear from. I see your hand up, Tom. So I'll call you back if there is nobody new that wants to come in. I don't see any other hands going up from the yellow hand, so to speak, if anybody wants to wave. No? Okay, I'll give you a chance to come back then, Tom. Oh, and Tom, there, just seen you as well, so afterwards, Willem.
Hi.
You're muted, Tom. Tom, sorry, you're still on mute.
How's that?
That's better. Yep, that's it.
Just like to flag up Afghanistan in that Global Britain and the Integrated Review got a real ear bashing when Afghanistan was debated. So I would like to point out that Johnson's image failed a great deal in that idea of Global Britain. I think it'll have to be adapted in a major way, because despite, 112 pages of foreign policy, etc., when it came to Afghanistan, Global Britain and the ideas of the Integrated View made not a ha'porth of difference, and it is seen as a huge humanitarian crisis which will go on. And I'd just like to make that point, that however many spaceports or nuclear weapons we have, deterrence, etc., it didn't help in Afghanistan one tiny bit, and NATO is also embarrassed by that.
Thanks, Tom. I've got hands going up. I've been Tunde in.
Hello. Yep. So hi. I guess the question I've got is just in terms of reconciling. My question is just essentially, I mean, reconciling nuclear power. So it's adopted by many developed nation states.
Disarmament. So just in terms of how that would be adopted as going forward.
Thank you. And Margaret, I'll just bring you in, and then I'd like to bring Kate and John Puntis back at the end for some final comments. We've just got 5 minutes left. Thanks.
Yeah, did you want me to say something? No.
Yeah, go ahead, Margaret.
Okay. Yeah, apologies for arriving late, and the reason for that was I had to go to the dentist for a hygienist appointment, and I said to the young girl that was doing my teeth, I said, I really ought to be going because I'm going on a Zoom CND discussion. And this led to about 20 minutes of nothing to do with my teeth, but all about CND and the importance of the discussion. And these two young people were completely wrapped up in it. They said, we had no idea about this. We had no sense that this was going on and that the government is committing this kind of money to a nuclear warhead. And it's just a plea really to say, how can we raise the awareness amongst that generation? She said, we're not used to discussing these things. And I said, no, you're not, are you? It doesn't happen. They all knew about Extinction Rebellion, but they knew nothing about CND. And I think, you know, their question was, what's the age group of your organization? And I said, well, it should be everybody really, you know, but I didn't know the answer to that. But I'm just putting that out there because it would have been a really easy thing to have got them interested today in what this discussion's all about. And I just think, are we missing something? How do we reach them? I'm sure this has all been discussed before, but it really hit me hard today.
Thanks, Margaret. Yeah, really important question. And I mean, we are starting to link more, not just nuclear weapons, but the military industrial complex to the climate change discussions, but we're a long way from it. But I will hand over to perhaps take John Punter first, and then Kate with responses to those final two contributions and any final remarks you want to make. Thanks.
Thanks, Sam. I couldn't really hear Tunde's question, but suspect it was more directed at Kate than me, so I'm not going to attempt to comment on that. I mean, Margaret's point about how we involve younger people is highly relevant to comp as well, and I think we're all struggling. We're all struggling very much with that, but actually linking up climate change and impending ecological disaster with healthcare is one way, I guess, and we're trying to do that perhaps a little bit more than we were. I mean, just to summarize some of the things I was saying, or pick out a few points. The settlement for social care is not the plan that solves social care. I mean, it's clearly nowhere near that, and it's a complete con. And we need to have a national care support and independent living service, which is a completely different vision of what social care should be about. And it puts at the centre those who use care services, and it also is very focused on co-production of solutions with people with disabilities, for example. And it has to be funded out of general taxation as the fairest way of doing things. Meanwhile, there's a lot of very rich people who should have their tax bills increased, and the whole business model of the private healthcare system needs to be not only challenged, but absolutely fundamentally changed. In terms of the health and care bill, I think people need to be talking to their MPs about it, but also very much their local councillors, pointing out the loss of accountability, the loss of the way that the public, through their local representatives, can actually influence what's going on in health. It's making all the decision making even more distant than it is at present. So loss of accountability is something that should exercise local councillors. And then some things should even get Tory MPs excited, because the bill is going to abolish the requirement for assessing patients' care needs before they're discharged. So they're moving to a system of what's called discharge to assess, which means as soon as someone is physically able to go out of hospital, they're sent home, and then their care needs are assessed. But of course, that could work if you had good, strong community services to pick people up, but we don't. So it will be a disaster, and that should be something that everyone knows about. And for people who want a quick rundown on these kinds of issues with the bill, there's quite a lot on the KMP website, but also the Health Campaigns Together newsletter and the lowdown. Both you can find easily on the web, and they give a very simple but good rundown on the issues, and also the things which are likely to cause some anxiety amongst MPs, including even Tory MPs, so to try and build up opposition to the bill, or at least the most toxic elements of the bill. Thank you.
Thanks, John. And sorry we're running over slightly, but we'd just like to obviously bring Kate back in for any final points. And just to clarify, you did cut out a bit, unfortunately, when you asked your question, but it's about the links of nuclear power in developing countries. So Kate, if you want to come back with responses and any final comments, thank you.
Yeah, sorry, yes, I didn't hear the first part of your question, but I could just say something very quickly about that. I mean, for a long time, there was a kind of a narrative going on about, nuclear weapons are bad, but nuclear power is good, because it can be electricity that's too cheap to meter and all that sort of thing. And of course, that's been found not to be true. The new nuclear power station, which is being built in Britain, has been already, it's already established that the power that's going to come out of that is going to be many, many, many more times more expensive than the power which is now being increasingly abundantly provided by sustainable energy and so on. So there's no economic argument for nuclear power because the sustainable energy forms are here, and there are also many arguments against nuclear power, including there's no safe storage method for the toxic nuclear waste and so on. So and also it's not carbon neutral either when you take into account the whole life cycle of it, mining of uranium and so on. So there's no good case for having nuclear power and no necessary case for having nuclear power. And of course, the same applies to developing countries as well. Why would you spend large amounts of money into developing that form of energy and technology when sustainable energy forms, including now the capacity to store renewable energy and sustainable energy forms, wind power and electrical, other forms of electricity and so on. But we haven't got time to go into that, but that's basically my position on that. And then just finally on Margaret, what you're saying, you know, I mentioned, or I don't know if I did, yesterday I was on a demonstration, kind of part of the arms fair protests yesterday, and it was overwhelmingly young people on that demonstration, you know, and we know that young people are incredibly concerned about the climate. They are also concerned where they know about it, about militarization and that kind of thing. Polls on nuclear weapons, which show the overwhelming majority of the population against them. It's even more overwhelming in the younger age demographics in all those polls, you know. So the young people are on our side. In fact, they seem to be on the side of pretty much any progressive demand there is out there, any progressive concern out there, you know, whether it's climate change, Black Lives Matter, or what, you know, they are by and large very concerned about these things. And I'm pleased to say that Youth and Student CND, which had been in the doldrums for a while, is now really coming back into life. We've got a great new group of young people really raring to take that forward, making the international links around it. So yeah, there's work to be done on every front, but I'm proud to say that CND has a membership which includes every age, and we want every age involved in this campaign. So thanks very much, everybody, and please support us if you can.
Thanks, Kate, and thanks, everyone. We will close off now. I just wanted to flag, obviously, for trade unionists, you can obviously sign up as well, affiliate your trade union and branch to CND, so do visit the website for that. And CND ran a really brilliant number of webinars during lockdown webinars, I think they were called, as well, which are all online on the CND YouTube channel, which also explores a number of the issues which were discussed here today. So do check those out also. And thanks again, and hope to see some of you on the way to the COP Glasgow talks in November, where we'll be bringing these issues as well into the conversations. Thank you. Bye.
Thanks, Sam. Thanks, everybody.